Welcome to another segment of Health Matters. Extended interviews with physicians, dietitians, and specialists from the University Medical Center. We use portions of these interviews on WVUA 23 News, and a podcast and web extra video of the entire interview is available to you online.
For this week's Health Matters, we are sitting down with Dr. Brian Gannon, a pediatrician with the University Medical Center. And today we're going to be talking about the challenges many kids face when dealing with migraines. Thanks for joining us today, Dr. Gannon. What can you tell me about migraines that many children are dealing with?
It's good to be here. Thank you for inviting me. Migraines are really one type of headache. Many children have headaches, especially teenagers. Probably almost 30% of teenagers report having headaches to some degree, but only some of those are migraines.
Yeah, so what's kind of the difference between a migraine and a headache, and how should you be able to tell?
Well, you know, it takes a while to figure out that migraines are the thing that's going on. Many parents really need to track the symptoms and look at exactly what's going on with the headaches. So headaches, if they're not that common, they may not be a big deal. Sometimes there's something really obvious going on, like they have a fever with it, and so it's from an infection, or they may have cold symptoms with it. So sometimes it's just really obvious because it's something that comes out of the blue. But when people are having headaches more often, like every week or more than that, then it's really helpful to do a headache diary. And the teenagers can do that themselves, but parents can also be part of that process. And tracking the pattern of the headaches over time is really helpful.
Yeah, what are some things or patterns that are normally there that tells you have a migraine?
Right, so the things that we would want to know in a headache diary are what time of day did they happen, what kinds of foods were they eating, was there a change in their habits for the day that the headache occurred. Those are some things that are helpful. But migraines specifically have a lot of other symptoms going on. Instead of just your head hurting, they will make children, especially, or even adults, throw up with them. They may feel sick to their stomach. They may have weird visual symptoms like spots floating in their eyes or blank areas. They may have a weird smell that happens before they even start with the headache. So they're just a little different than other headaches. The other big thing that's different for migraines as opposed to other headaches is that light and sound are often really difficult to deal with. So they'll be really sensitive to just normal light in the room. You'll find a lot of times someone with a headache needs to be in a dark, quiet room, and that helps them deal with the headache.
And why is it more found in women than it is in men?
I don't think we know that completely. There are certainly hormonal components to that. There are some women who have more trouble with headaches at a certain time in their cycle. Before puberty, we actually find that it's about even between boys and girls, but after puberty, a lot of the boys with headaches, with migraines, will outgrow those, whereas a lot of the girls may not even start with migraines until after puberty, and then they continue through the life cycle. There are a lot of women who, once they go through menopause, their migraines get better. So there's definitely a hormonal component there.
Yeah. What are some natural provisions people can do?
A big thing is managing hydration and sleep schedule. We know that when someone's sleep schedule is off, that will often trigger a migraine the next day. Part of that is driven by electronics use. So when kids are on their devices late into the night, and maybe it's not every night, that would be one of the things that you would track with your headache diary. And if you notice there's a clear connection between the amount of electronics use or whatever happened with sleep, and then they're more likely to have a headache the next day, then that is something to pay a lot of attention to, so that you're getting 8-9 hours of sleep every single night rather than just hit or miss. And of course, that can also be driven by stress. If a teenager has a test the next day, they may not get as much sleep, and then they may have a migraine on the day of the test, which is frustrating. Another big natural thing is hydration. We find that people who are not drinking enough water are more likely to have headaches, and migraines especially. So in the summer, we see a lot more association with that. And they say that you should be drinking people with migraines should probably drink about 1 gallon of water a day. Avoiding caffeine is helpful. we find that caffeine can trigger migraines, but if you're going without caffeine, then sometimes when a migraine starts, drinking a little bit of caffeine can actually fend off the headache.
So do migraines kind of progress as you get older, or can they start out young?
They can definitely start young. About half of people who have headaches as adults started before they were age 12. So many times people who do start with headaches at an early age will continue with them on in life, but some of them do outgrow it. So we definitely should be aware of it. The problem is that children younger than about 10 or 11 are not great at describing the experiences they're having. So they may just call it a headache and not give a lot of detail to the family. So it can take a little bit of detective work on the part of the other family members to figure out what else is going on with the headache.
So what should people do if they have a younger child that is kind of experiencing headaches pretty regularly?
Well, certainly do the headache diary. You may find that there is an association with a certain time of day or a certain experience. It might be related to not drinking enough. Could also be a specific food. There are a lot of food additives that can be problematic. Caffeine I mentioned, but a lot of dyes and other additives like MSG can be a problem. So trying to avoid those and sticking to more natural foods can be really helpful for children of all ages.
Do you see any treatment misconception? Because I know I hear a lot of people do an earring or different things.
Yes, I think what we want to focus on is all the natural things first, like diet, sleep, paying really good attention to all that hygiene. There's really not a magic bullet that fixes migraines. It's all these lifestyle changes are really the most powerful tool that we have. There are really great medications available, and so for people who have a severe migraine pattern where it's happening several times a week, interfering with their work schedule, school schedule, for those people, absolutely preventive medicines can be helpful. But for most people, just tracking the pattern and making some lifestyle changes will make a big difference.
And how would those people go about it? Would they get an MRI first? Is that kind of the next step if the natural prevention does not work?
So where we usually start with that is going to your primary care doctor, who will take a good history like we just were discussing. And many times we can tell the difference between a migraine and a different headache type simply by asking lots of questions and doing the headache diary, doing an exam. If the exam is essentially normal, then an MRI is usually not helpful. But if it does seem to follow into that migraine pattern, then we have all sorts of different options available for prevention.
Absolutely. Well, is there anything that I haven't asked that you would like to add?
One other thing for people to remember is that many times people are afraid of pain medicine with migraines, but for people who have the aura where they feel the headache coming, it can be really helpful to take something as simple as ibuprofen as soon as they feel the headache coming. And that can be what we call abortive therapy, so that the pain goes down and it doesn't ever really take hold like it might otherwise. So, that's hard for younger children. They don't always have that self-awareness. But as people get older and they see the pattern, they often realize, oh, I'm going to have a headache today. And if they can catch it early, then they may not always need those long-term preventive medicines.
Absolutely. So it can make a really big difference trying to catch that early. But for younger children, what are some things that parents, because I know we've talked about how difficult it is to keep track of all of it and to make sure that they are just having a headache between a migraine, but how do you really tell when they're younger?
I don't know that you can always. Certainly if they seem to have a lot of fatigue with a headache and it stops them from playing and doing what they would normally do, especially if they're throwing up every time they have a headache, then those are really your best signs that this is not like an allergy headache, but more of a migraine headache that might be able to be treated with some of these lifestyle changes.
And having a migraine headache that's that severe, Could it be also a cause of other things or other, like one of the symptoms of something else going on with your body, or is it just normally just migraines?
Most of the time migraines are kind of their own thing, but there are migraines that occur without a headache. So there are some weird kind of behavioral things that can happen that are in the pattern, in the family of migraines, but don't always occur in the presence of a headache. So I mean, some migraines will look almost like a seizure, and it's really weird and scary, but that's not a really common thing. And most people with migraines will not have like major other problems. It doesn't likely to stroke or developmental problems or behavioral problems or anything like that. The bigger issue with migraines is just missed days of school, missed days of work, because when a migraine does take hold, it can take 12 to 24 hours to come out on the other end of it, and that's why it's so important to think about abortive therapy, both in terms of lifestyle changes so you aren't having as many episodes, and then when an episode does start to come on, if you can catch it at the very beginning before it really gets bad, then you may be able to preserve that day of school, day of work.
Absolutely. Well, thank you so much for joining us today.
You're welcome. It's my pleasure.